Our goals in doing the study were twofold. One, as I mentioned, was to find drug targets that we could go after. And the other goal is to try to find biomarkers to try to predict either someone who's having the autoimmunity at that moment, or B, even somebody who's going to develop that autoimmunity even before initiation of immunotherapy. And so for the first goal, what we found on these TAMRA CD8 T-cells in the blood of our patients with myocarditis is that these TAMRA CD8 T-cells are also expressing very high levels of certain kinds of chemokines, so CCL5, CCL4, and a couple of others. And so we think that these chemokines may be playing a role in helping attract and recruit other immune cells to the area of inflammation, in this case, the heart. And so we think that these are actually attractive drug targets to potentially go after. And so in our mouse model, what we're doing now is working on blocking some of these pathways to see if we can attenuate the myocarditis in our mice. Another goal, so the biomarker goal, is really in understanding how to predict and also how to diagnose, myocarditis as it's happening. So in terms of diagnosis of ICI myocarditis, it's there's not a single modality that necessarily kind of covers everything. So you can diagnose it with cardiac MRI, for instance, but there are cases where cardiac MRI may not necessarily be 100% sensitive. And there, you can also do cardiac biopsy, but that's a very invasive technique. And you can also have issues with sample bias, sampling missing, the part that's actually inflamed. And so, and then, of course, you can have the other sort of circumstantial evidence like the elevated troponins and the clinical syndrome, EKG changes, and echo. But it would be great to find a blood biomarker that would be, inclusive and helpful in diagnosing the disease. And so that's part of what we're working on. And clinically speaking, we also have a clinical program that we are doing right now where we're using troponin, for instance, as a biomarker to monitor and screen patients who are receiving immunotherapy, and seeing if early elevations in troponin are predictive and can be helpful in preventing and catching potentially early cases of autoimmunity. So, TBD.